Dr. Robert Marx produced this video to answer the many questions you may have concerning dental implants. Hi, I'm Christina McCauley. Welcome to Eye on Dentistry. There are approximately 100 million people in North America with one or more missing teeth. Now, patients have a number of restorative options, but none have proven to be as functionally effective and durable as dental implants. In this episode of Eye on Dentistry, we'll look at the potential consequences of not replacing your missing teeth, the options for restoring your smile, and we'll talk to actual patients and doctors about their experiences with dental implants.
Well, it's very unpleasant to have a hole in your mouth. Food gets stuck in there. It's unsanitary. It's long-term unhealthy for the rest of your teeth.
I decided to get dental implants because the experience of wearing dentures was so painful. It's a major disruption in the quality of your life to be living with dentures.
Many times I canceled dinners because I couldn't eat well. You know, it's not funny when you can't eat.
To understand if you might need a dental implant, it's first important to understand your teeth in relation to your jaw and their dependency on each other to survive. Even with a great smile, missing teeth, if not replaced, can lead to additional dental problems. Now, your teeth can shift, making it difficult to keep them clean. Over time, gum disease and bone loss can occur, shrinking the foundation for tooth support, which can put you at risk of losing additional teeth. A shrinking jawbone ultimately changes the shape of your face. Your mouth and jaw will appear to collapse, your lips will appear thinner, and your skin will begin to wrinkle, especially in the areas around your mouth and neck. Dental implants can help prevent jawbone loss and preserve those facial contours.
Implants were there to keep my teeth straight and then also help preserve the bone.
I didn't know that I would lose the bone when I had the bridge put on, and I ended up losing that bone. And when I went for the implant, they had to do a bone graft first. They did the bone graft first, and then I had to wait for a period of time. Whereas if I would have gotten the implant right from the beginning, I would have had enough bone and I wouldn't have had to go through that expense either.
In addition, missing teeth can lead to muscle strains, headaches, and inability to speak clearly, unease around family, friends, and coworkers, and of course, the loss of your beautiful smile and self-confidence.
I can speak clearly too. A lot of people with dentures can't do that.
The experience of eating with dentures is a painful experience. You don't have the taste of the food hitting your palate, or that sensation when food and drink hits your palate.
Dental implants are artificial roots that serve as a replacement for missing teeth. They can be used in both the upper and lower jaw. After the implant has been placed, the bone forms a biological bond with the implant, giving your new crown a solid foundation as permanent as the root of a natural tooth.
I defy anyone to be able to distinguish from an implant and a natural tooth.
It feels like my natural tooth. There's a little, it's not quite as sensitive as the other teeth are, but it feels very, very natural.
The implants are like my regular teeth. They're strong, I can eat anything I want. The bridge, I was always concerned. I hated the bridge because I couldn't floss. I had to use a special flossing technique with the bridge, and it still didn't feel good. It didn't feel like you were really getting it clean.
The fixed bridge solution is exactly like having natural teeth. You forget completely that you don't have natural teeth.
Dental implants have been a miracle that has allowed me to help people lead better lives because they can have teeth that feel and look like they're natural teeth and are strong and solid and stay in place. But some people are a bit apprehensive about the idea of having a dental implant placed, and they ask me, is there discomfort associated with placing a dental implant? My experience has been that dental implants have very little or no discomfort during the placement of the implant or after the placement of the dental implant. I often call patients the next day to find out how they're doing, after the procedure, and almost always they tell me that they had zero discomfort when it was being placed and almost no discomfort afterwards. They're very impressed by that, and they often mention that in fact there was less discomfort with an implant than almost any other dental procedure. Sometimes I have a dental patient who's very apprehensive about any type of procedure like that. So I will have them call another patient who has perhaps had a dental implant, and they could ask them, how did it go? And they're almost always impressed by the fact that the patient will tell them they had zero discomfort during the placement of the implant. They're almost always reassured by that.
I was really surprised. I thought it was going to be very painful, and it wasn't.
I didn't even need to take the pain medicine, really, just Advil, Tylenol.
Getting the implant was very, very easy for me. It ended up being very painless.
I never had any discomfort at all.
The benefits, in fact, are many. Dental implants will stop the bone deterioration process, restore your mouth to its natural state, provide the look, feel, and function of natural teeth, not compromise adjacent teeth, increase stability, eliminate the pain of dentures or partials, improve your ability to bite and chew, and maintain your appearance and self-confidence.
I ate the night of the surgery. I couldn't get over it. It's wonderful.
It's an aspect of your youth, a carefree strength and a feeling of confidence that you have about your presentation and about your sense of being that is restored.
Prior to dental implants, a frequent option for replacing a single tooth or multiple missing teeth was the traditional tooth-supported bridge.
If I knew then what I know now, I would have realized that, bridges don't last that long. They only last for maybe 10 years if you're lucky. Mine lasted for 6. So here I am in the same position again, except I have 2 extra teeth that are ruined from the bridge. So now I have to get 3 new crowns and the implants. So I wish that originally I would have done the implant.
There are implant solutions for one, several, or all missing teeth. Implants are the anchor for a new restoration that doesn't compromise adjacent teeth. It preserves the bone by replacing the tooth root and provides stable replacement teeth that look, feel, and function like natural teeth.
I didn't like wearing the Polydent and the grip adhesives.
As a dentist, I'm dedicated to trying to improve patients' lives and their ability to function and smile and eat and enjoy their teeth. But dentures, when someone has lost all their teeth and they're forced to wear dentures, is really one of the most frustrating things to deal with for the patient and for the dentist. But dental implants have changed that dramatically, because now we can offer a patient a technique where they can actually have teeth that stay in place, look and feel just like their natural teeth, and they're able to enjoy their life with very little attention on their teeth. And unfortunately, when we do lose all our teeth, there are several things that you could consider negative. One is that dentures over time become loose. They just don't fit the same after a period of time. And the actual jaw that holds the teeth in place, once it's lost, the jaw begins to shrink. And so dentures become loose and sore and etc. But implants have changed everything. We are now able to offer patients an ability to have teeth placed with implants supporting them that feel like their own teeth. They stay put, they only come out when the patient wants them to come out. For people who are battling dentures or are facing having their teeth removed, there's now hope like they've never had before, and that hope is dental implants.
But with implant-supported overdentures, there's no slipping, and chewing ability is restored. Overdenture implants maintain the integrity of the facial structure, preserving the remaining bone and virtually stopping the deterioration process. They increase comfort, provide solid stability, restore natural chewing, feel, and ability, improve facial appearance, and eliminate the need for adhesives. When we come back, we'll discuss what makes someone a good candidate for dental implants. Welcome back. Sometimes older patients express concern that their age may prevent them from being good candidates for dental implants. Actually, health is more a determining factor than age. If your gums and bone are healthy enough to have a tooth extracted, you're probably healthy enough to receive dental implants. Every treatment situation presents unique conditions that can affect the longevity of a dental implant. With favorable healing and proper care, most patients can expect their dental implants to be a lifelong replacement for their lost teeth. Every day, more and more people are discovering that dental implants are the best solution for replacing teeth and restoring smiles. Dr. Marx is a graduate of the University of Missouri at Kansas City School of Dentistry. He's received training in the placement of dental implants and has performed several thousand implant procedures. Dr. Marx is very involved in his community and is the founder of Have a Heart Day, on which he and his staff see hundreds of children free of charge, children who otherwise would not receive dental care. Dr. Marx is committed to improving the lives of his patients through better dental health, which is achieved through ongoing communication, state-of-the-art procedures, and quality care. This dedication to his patients is why Dr. Marx has been voted Best of the Northland by the Gladstone community for the past 8 years. Dr. Marx's collaborative relationship with the Northland's premier restorative dentist has ensured thousands of successful implant procedures.
Yes, I would recommend implants. As a matter of fact, I have to my family, my friends. My father's getting his second one actually next week. We talked about it yesterday and I saw him.
I'd recommend it to every person that could be wearing dentures. There's truly nothing that has, in terms of taking one action or one step in my life, that has impacted the quality of my life more.
I would definitely recommend dental implants to anybody who was thinking of getting them, because the process was pretty painless and just the overall result is just really great.
Ask your dentist if you're a good candidate for dental implants. To schedule a consultation as the first step towards experiencing the life-changing effects of dental implants, please call Dr. Robert Marx at 816-452-2000.